Welcome back to Aesthetics Unscripted. This is your host, Kim Ladati, and I'm here with some of my core team at IT Intelligent Treatment and co-host Angel from ANJ Media. We're talking about surgery, to cut or not to cut.
So when you have a patient come to you and they're getting service done, what's the honest reason why they say they want surgery for something?
It would be depending on the age is
Mm-hmm.
one thing. But majority of the time is more of flaccid loose skin. If they see more of a what I like to call the turkey neck, when the neck itself or just this area just starts to fade and it's just one thing connected to the other, like your jawline to more of they just see that the skin itself is not what it used to be. So it's more of coming down, or gravity at this point is doing its job and then not pulled up. There's no definition, no nothing at that point.
And what about with you?
I agree with those things. I think also oftentimes people decide to go through surgery before if something's important is happening, like, I don't know, a mother whose daughter is getting married. And so maybe they decide, oh, now it's the time to invest in this as well because I want to look my best. That's kind of like answering more on like the circumstances of the situation. But yeah, I agree with Mel. Like depending on the age group, there are certain areas where they might be more concerned about. Sometimes they've tried a lot of other things and it didn't work.
Mm-hmm.
And so they're like, okay, I've done this, and this. Then they'll ask, should I be now considering to go under the knife? And sometimes they are a good candidate, and sometimes that's going to be the best investment of their time and money. So sometimes, I mean, I am an honest person, and I think sometimes for some people that is the right.
Like if that's the result that they want, like that is what they
right. And if they're willing, for the downtime and the money, and they like that look also, because I think for a lot of people who are not wanting to do surgery, it's not necessarily the aesthetic that they're going for, and I agree with that. Like that's not the aesthetic I like, and luckily we have alternatives to it. But if someone's kind of like, I do want more of a drastic change, that's when they kind of decide that they want to go through surgery.
I also think it has to do more of your self-esteem in a way. Like when you say life is really hitting you hard that one day and you just look at yourself in the mirror. I get that sometimes. So.
I was going to say, it might have been this morning with that little, oh God.
So I would say it depends also on how you're feeling that day. There's a particular day where you're like, I just need a little pick me up right here, or I just need this, and then you're fine. And then it just comes again. This is the time where you're like, what can I do to make it better? What can I do? And then these, I would say, doubts and stuff starts to happening as well. So it's more of, you're suddenly in your 20s and your 30s and everything, and suddenly out of nowhere, time flashes and you're like, where did time go by?
But not in your 20s.
No, that's when you're before and after. Sometimes in my 20s, I'm not going to
lie. No, but I'm saying, like, you're not going to get a facelift on your 20s.
No,
you but there are
surprised.
That would be but that's what I'm saying. We shouldn't, unless it's someone that, like, really, no judgment. Anyone can do whatever they want.
Like, well, some people might know.
Anyone can do whatever they want, but I do think that, we've gotten to a point where people are
skipping a lot of steps, maybe?
Yeah. They just want, I like to call it that they just want to grow too fast.
Right. Well, we're in a social media environment. We're in a social media world. So I find the younger the generation, the more they want instant gratification. And if you have $3,000, for example, you'd go and get an upper bleph instead of doing Somacell, which if you're younger, Somacell is going to help to tighten upper lid skin. That's droopy, especially if you're inherently a certain ethnicity, like Asians in particular always tend to have droopy upper eyelids, but that could be any ethnicity, right? As we age, the upper eyelids are not where they used to be anymore. So the quick fix is to go get an upper bleph. And upper blephs are being done rampantly right now. They're so popular that all plastic surgeons are just having a field day with this. I'm not saying it's wrong depending on the patient, but when you're younger, you always have to remember there's only a certain amount of times you can cut any one particular area. And every great plastic surgeon is going to point that out. So plastic surgery is also not forever. So don't think you're going to get a facelift when you're 35 and it's going to be forever. The average length of a facelift lifetime is 10 years, and you expect to repeat that facelift 10 years later. So, buccal fat pad removal is a surgical treatment that costs many establishments less than $1,000, and it's an in-office procedure that I despise, and I very rarely say that about a treatment. So, once you take that fat pad out, you can't replace it. It is there to give your face structure.
Mhm.
It's there to lubricate, actually, to help lubricate and keep the lubrication in the inside of your mouth. So you're not chewing on the inside of your face when you're speaking and when you're eating. And if you look at celebrities that have had this done just 2 years ago, they already look like skeleton face. They look like Skeletor.
Mhm.
I'm dating myself by that reference, but you end up really looking like super sucked in.
Mm-hmm.
So, like Melanie said, surgery is a very emotional procedure. It's tied to a lot of emotions, but you don't want to lose yourself to body dysmorphia. You don't want to get so enamored by a figure on social media, a celebrity, whoever that is, and say, I want to look just like this person, and then lose yourself chasing surgery after surgery to try to look like someone else, or to give yourself too much of an ideal and turn your back on all conventional treatments that could help to tighten your skin, that can help to regenerate skin, that can help to rejuvenate skin, and just automatically reach for the knife. So too much now, I think, and many top plastic surgeons that are very reputable are coming out against their own profession
Mhm.
by saying too much now, people are reaching automatically for surgery. You can do things to restore, regenerate, and tighten skin like Somacell first, as an example. You don't always want to just run out and jump under the knife, because there is a limit to how many times you can cut each area.
Well, also there are trends, right? So like
Yes.
something that might be trending now in
Mhm.
2 years might not be like.
Exactly.
So the appear like the aesthetic of whatever X trend is happening now, maybe in 2 years is no longer. And if you went through surgery, you went through surgery, right? Like you did that.
I also feel like people don't understand that when you go through the knife, it's not necessarily, procedure, then you're done. It's a lifetime change that you have
Mhm.
to. It's a commitment.
Right.
If you're getting, let's say, your mommy tuck and everything, you're gonna get it done, but then there's things that you have to do afterwards in order to maintain it.
Right.
So you
can't
cannot you cannot eat the way that you used to be.
Exactly.
You cannot, you have to, unfortunately, you have to wear the faja to make sure that you maintain the silhouette that you want to. You want to start eating healthier, make healthier choices. You want to start going to the gym a little bit more, a little bit more often than before, because once you get it done, you might not have the same body that you had before, but you
Mhm.
will see that the fat itself that you consume is going to be placed in different areas. So you might look a little bit funny in that sense. And then that's where more surgery, oh, well, I want to get this done because my arms look fatter than my body looks now, or,
Mhm.
Right.
So this is where everything goes like in full circle. Not in a good way, but it's something that you have to keep in mind as well.
When is surgery actually the right choice?
I'm going to jump in on that one right away by saying, for example, upper blephs.
Mhm.
So when you're talking about upper eyelid skin, there is a point, regardless of your age, if you have too much loose skin there and it's starting to obstruct your eyesight, then that is a perfect surgical candidate. That's not something that you could say, oh, I'll just, go get a little laser on my upper brow and that'll help to tighten. Pre and post treatment, Somacell will help to build up the strength of your connective tissue and your skin, but it's not going to be able to tighten the skin to the point where you're going to be able to have unobstructed vision, for
Mhm.
example. So, pre and post surgery, great. But do you actually need the surgery? Absolutely. If someone has gone through aggressive GLP-1, right? And they have all that loose
Flaccid skin.
skin and the Ozempic ass and the Ozempic everything, and everything is falling off, or they had a lap band, or they did it naturally and they've lost 100 plus pounds.
Pretty quick, yeah.
If you do it quickly, that skin is not going to shrink with you, and you literally have just folds and folds of
Mhm.
loose hanging skin. That has to be a nip and tuck for sure.
Hmm.
Women post pregnancy, post delivery, some women might have issues with flaccid skin just in the lower abdomen area, or
Something ruptured.
right, or privately, you know, you might need to have a revision. So we're not talking about trauma. Technically, this is not like I got in a car accident and need surgery. Obviously, we're talking about cosmetic surgery, but there still are areas of cosmetic surgery that you should jump in. But it's funny because it's interesting when we throw this around to see how each person feels. So I think I know how you're going to respond. But like, say, Monica, what if someone wanted to get a nose job and they honestly said, "Hey, Monica, what do you think about my nose? I always wanted to just lift the tip a little bit, even though everybody tells me there's nothing wrong with my nose." Like, what would your response be back to them if they were asking just for candid advice?
Me personally, I would always say, it depends how the person feels, and if that's, if they definitely are not happy with the way that they look, and that's the only option that they see viable. I'm not a doctor, so I wouldn't be able to really say, if you're a candidate or not, or if if what you're trying to achieve is possible. Um, but I don't personally believe in giving that sort of advice as to like if they should or shouldn't do. I think it depends on how they are feeling, and um, maybe help them walk through all the scenarios and the things that what it entails, and the recovery and the cost and those things. But I would never be like, yeah, you should get that surgery.
Or
I don't know.
not?
Or not.
Yeah,
Yeah.
that's where your medical aesthetic providers, us professionals, can help you give an opinion. And that is just, we're not telling you yes or no. We're just saying, listen, if you're in an emotional state where that is the only thing, as Monica pointed out, that's going to make you really happy, then we can help to refer a qualified, board certified plastic surgeon. We all have experience with helping patients recover from downtime post surgically. So we can give you an insight, as Monica pointed out, into that. You know, it's not just cut and then go out running around the next day. So, or it shouldn't be at least.
Yeah.
But we're not going to tell you yes or no. We're going to help you decipher what is going to be best for you by helping you find a great plastic surgeon, too, if that's the case. But also pointing out that for many areas of the body, depending on the condition, there are always alternatives that should be considered first, especially if you're younger.
You have to do your research, if anything, just like an esthetician itself, not everybody's going to click with the patient. So ask the right questions, see how your doctor would answer it. So for me, if a doctor were to tell you, I want, like if I were to go to a doctor and be like, you know what, I want a breast lift, example. And the doctor was like, you know what, we should do that, and we should do this and this and that. But that's not what I asked for. I would like to know more about what do you think about this topic. If they do like a checkup to see how it is, I feel like it's very important. Then from there, if they advise you, you know what, if you're thinking in the future to do A, B, and C, maybe this is not what you should do first. So you always have to listen as to how they do your consultation is one thing, and what would they advise. If you see that a doctor or just anybody, a provider itself, is more of, you know what, since you're already doing this, why not add this, this, and that? That could be a little bit dangerous for you. That might not be in your budget or wise or anything like that. So that's already making you stressed in that sense. So you're already picking at other things that you might have not thought about it, and now you're thinking about it. It's more how comfortable you feel about with the doctor as well, or again with any provider that you're doing.
Yes. And then you also have to look out for the pitfalls when you're doing your consultation, because it's quite common in plastic surgery offices to have beautiful lighting everywhere except in the consultation room. So the consultation room is very bright and very harsh. And that lighting, there's always a mirror. That lighting is there on purpose. So we can
I never
point
thought
out,
of that.
like Melanie said, maybe you're coming in to talk about just a breast lift. And now we're going to talk about a breast lift and implants. And then, by the way, did you happen to notice this about your face? And here, look in the mirror under this terrible lighting. And I'm going to point all this out. And say, listen, it's a business at the end of the day. I'm not saying plastic surgeons are evil. There's plenty of fantastic ones.
Yeah.
But when your consultation with anything, as Monica has pointed out, as Melanie's pointed out in the past episodes, as I've pointed out in the past, and all of us always do, If it feels uncomfortable, seek a second opinion. If it still feels uncomfortable, seek a third opinion. Don't be afraid to keep seeking more advice. Just because you had a consultation with one plastic surgeon doesn't mean you shouldn't go and talk to one or two more.